Everybody's ready to roll. Good afternoon, everyone, and thanks again for joining us today. In a few moments, Dr. Morrison will provide her regular briefing on COVID, as well as an update on our testing, masking, and isolation guidance. I just wanted to start today recognizing the hundreds and thousands of people who are involved in the provincial response to COVID-19. Those individuals that are working extra shifts, they're working around the clock to deal with this current wave. It really is an all hands on deck approach that we're taking to this. Yesterday, I met with Minister Lawrence McCauley, who confirmed to me that 15 registered nurses would be joining our immunization team in the coming days from the Department of Veterans Affairs Canada. I want to thank Minister McCauley and his team at DVA for stepping up to the plate and assisting us in the days and weeks ahead to our all-hands-on-deck provincial response to this new variant. In addition, we've also rehired 10 retired public health nurses to join our team in the last week to assist with contact tracing and supporting those impacted by a positive test result. I want to thank these individuals for stepping up, for obviously having a passion for serving the public and to have returned to assist our province in this time of need. So thank you very much for that. I also want to thank our community pharmacies again and all of the healthcare professionals who are dealing with the day-to-day duties of their regular jobs on top of this regular recent Omicron wave. It's really been a tip-to-tip a response in this province in all settings, and I'm very, very grateful for that. I also wanted to take a moment just to talk about some of the issues that are being raised and some of the questions that many of us have that are coming from a place of frustration and fatigue. We've been into this grind for a long time, and it's certainly taking its toll on all of us. One of those issues is pertaining to sports and activities, particularly for our younger population. Nobody loves sports more than I do, in particular hockey. Nobody would like to see our kids back in the rinks and back at their regular activities more so than me. For myself, my oldest, my daughter, this is her last year of hockey. This is the last year of hockey for her friends of organized hockey, and I don't want them to miss out on this. I don't want any of you and your families to miss out on the things that you love to be doing, that they love to be doing, and that they need to be doing. And I know how important these activities are, and we're working hard to get them re-established as quickly as we can. Our focus has been on trying to get our kids first back into school. You know, just from an overall responsibility, from a provincial approach, we have to get our kids into the classroom before we get them back into the rink or get them back into their other activities. And our focus has been on that back-to-school plan. The fact that our back-to-school plan includes regular testing of students will give us an added comfort to begin to resume some of those activities on a limited basis around the same time of January 17th, if we're able to get there. Obviously, from a sporting perspective, we will start with limited practices, et cetera, but we'll take those steps back into getting our kids back to normal around that same time as our back-to-school plan, and we will announce some more details of that as we get more information. But that is our goal. But our priority has been back to school, and we're focusing on operationalizing those plans as we speak. Minister Jamieson is working with her department to announce additional supports for families and children who might be impacted by the fact they can't get to work or they're working from home and they need some assistance. And we'll be sharing those details when they're ready, hopefully this afternoon. Minister McKay, through Economic Growth, Tourism and Culture, is also working on filing the proper paperwork and going through the Treasury Board process to extend the eligibility for programs that were initially announced that were scheduled to only go to January 8th, but they will now be extended until January 17th as the order was changed on Tuesday. In addition to that, Minister Fox, through his community development portfolio, will also be announcing support for community centers, rinks, legions, etc. in the coming days because we know many of those community facilities are impacted by the fact that people aren't allowed to be in them at this particular time. So we are working on a number of those programs and trying to get these as right as we can. As we said before, developing programs quickly for 165,000 people is a very unrefined science. We don't get everybody with one swoop, but we are trying to be as open as we can and as adaptive as we can to make sure the individual families and those impacted can be assisted to the best extent that we can help. So with that, I'll turn it over to Dr. Morrison, and we'll get our most recent update on the COVID situation, as well as some of the additional changes we're making in terms of masking and isolation and other areas. So over to you, Dr. Morrison.
Thank you, Premier. Good afternoon. As I mentioned on Tuesday, today really is focused on some updated guidance around case and close contact management of COVID, and also updates on the test to stay policy, and some general comments as well on testing, as well as pregnancy and COVID-19. As of 8 o'clock this morning, there are 204 new cases of COVID-19 to report, bringing our total active cases to 1,491 and 2,288 since the pandemic began. Over the last 7 days, we've had an average of 156 cases per day. There are 4 people in hospital being treated for COVID-19, including 1 person in intensive care. 3 additional people are in hospital and have COVID-19 and are being treated primarily for illnesses other than COVID-19, where COVID-19 is not the reason for admission. And I think I said it on Tuesday as well, this is not the way we would have wanted to start 2022. And although this is a rough start to the new year, we do know it will get better. And last year, I know, really since the beginning of the pandemic, we've spoken a lot about gratitude and being thankful. And I think as we start this new year, it's also one of hope. And both of these hope and gratitude underlining a lot of hard work that goes into everything that we're doing. So it is the hard work of Islanders and everyone involved in the response that gives us hope that we are all going to get through this. So this wave, driven by the Omicron variant, is creating significant disruption for individuals, families, communities, and society in general. And nationally, Omicron is the dominant strain, and spread is happening at unprecedented levels. And in Canada, numbers in hospital are beginning to rise. Based on the evidence regarding transmissibility of Omicron, we will be adjusting the isolation requirements for cases and the isolation and testing for close contacts. The Omicron variant has a shorter incubation period, which is the time from exposure to onset of symptoms, than previous strains of COVID-19. Many other jurisdictions have announced changes recently in response to the evolving data and epidemiology of Omicron. Effective Friday, January 7th at 8 a.m., fully vaccinated individuals who test positive for COVID-19 must isolate for 7 days following the onset of symptoms or a positive test if not symptomatic. They may leave isolation after 7 days if they do not have symptoms or if symptoms are improving, including no fever for at least 24 hours. But they should not visit high-risk settings or individuals, for instance, those in long-term care, community care, or child care centers for 10 days from the beginning of isolation. Individuals positive for COVID-19 who are not fully vaccinated must isolate for 10 days following the onset of symptoms or a positive test, whichever is shortest. In terms of close contacts, if fully vaccinated, they must isolate for at least 96 hours after their last exposure to the case and test on day 4. Provided they do not have symptoms and have a negative day 4 test at a health PI clinic, they can leave isolation. They should self-monitor for symptoms for an additional 6 days. And during this combined 10-day period from the start of isolation, they should not visit high-risk settings or individuals. Close contacts who are not fully vaccinated must isolate for 7 days after their last exposure to the case. They can leave self-isolation on day 7 if they do not have symptoms and have a negative test at a health PI clinic. They must monitor for symptoms of COVID-19 for an additional number of days and isolate and test if any symptoms appear. Similarly, they should not visit high-risk settings or individuals for 10 days from the start of isolation. This affects all current close contacts who are in isolation. Anyone who is not symptomatic and currently in self-isolation longer than the new 96-hour if fully vaccinated or 7-day 96-hour if fully vaccinated or 7-day if not fully vaccinated requirements must have a negative test result from a testing clinic before leaving. Some may be able to get tested today and others tomorrow and others on Saturday. I ask that you please be patient and not bombard the testing clinics today. The clinics have limited capacity and we need to spread out the demand for testing as much as possible. While most individuals with the Omicron and Delta variants do have symptoms, not everyone does, hence the requirement for close contacts being tested before leaving self-isolation. If you have the virus and are not symptomatic, you can still spread it to other people. Detailed information, including a question and answer regarding these changes, will be available on the website by tomorrow. These changes balance the risk of transmission with the need to safely isolate people for the shortest period of time while minimizing disruption in our province. Having said this, these changes do not come without risk. It is important that individuals who are cases and close contacts respect the new isolation and testing requirements. We have had a number of questions related to masks, especially what type of masks are most appropriate. Wearing a face mask in the community is an added layer of protection against COVID-19 and its variants. Other important measures to help limit transmission include staying home when sick, physical distancing, hand hygiene, and respiratory etiquette. Masks are required in indoor spaces and PEI and outside when physical distancing is not possible. Masks come in various types. Non-medical, typically a 3-layer mask made of tightly woven fabric, including a middle layer or filter. Medical-grade masks or a surgical mask, and then respirators or N95 masks. And these are best used by healthcare workers who have been properly fitted for this type of mask and trained in how to wear them. They are not the best option for everyone in the general public to use. If you are concerned about being around others who may not be masked, consider wearing 2 medical-grade masks, which provides very good protection, and maintain physical distancing to reduce risk and transmission. Wearing a good-fitting 3-layer mask and wearing it properly is essential. A mask hanging around your chin or pulled below your nose is not protecting you or others. And we talk about when you breathe out, you can transmit virus. So you want to wear your mask so that you're protecting others, but you're also protecting yourself by not having the ability to breathe in other particles as well. Please refer to the Provincial website for information on how to correctly wear a mask. As our active case numbers rise, so too does the number of people required to self-isolate, with each case having an average of 4 close contacts. As I mentioned last week, we have implemented a test-to-stay policy to support the provision of essential services in the province. This policy allows our office to grant approval for an essential worker who is a close contact and does not have any symptoms to go to work under certain conditions, including daily testing, monitoring for symptoms, physical distancing, and masking. This policy does increase risk of transmission and will be used sparingly and in exceptional circumstances in order to maintain essential services. Workplaces that provide essential services that are impacted by staff being in self-isolation because they are close contacts can submit an online application to be considered under the test to stay policy effective immediately. Employers submitting applications will receive a response within 24 to 48 hours. More information is available on the provincial website under the test to stay policy. Testing continues to be a key pillar of our provincial pandemic response. The ability to test for COVID-19 allows us to identify cases and fulfill our important responsibility to conduct disease surveillance and report nationally. Our testing strategy has evolved as we move through various phases of the pandemic. In March 2020, we did not have the capacity to conduct COVID-19 testing in PEI, and all our samples were sent off-island. Since that time, we've established tremendous capacity to conduct PCR testing at our provincial laboratory. We began using ID Now molecular tests first at the points of entry and now at the health PI testing clinics. In recent months, the rapid antigen screening tests have become an important aspect of our provincial testing plan. We've always maintained a targeted approach to the distribution of rapid screening tests. First, to provide testing for families with children who may have trouble accessing provincial testing clinics. Then to support the vaccinator test policy in long-term care, community care, and numerous frontline service providers. Then we expanded more broadly to include all children in early learning and child care centers and schools to ensure children and families have access to home-based testing. Then to allow children to return to in-class learning when there are cases in school. In choosing to focus on a targeted approach, we have opted to support those who benefit the most from access to rapid screening. We have had questions about the supply of rapid tests. In January, we are planning to receive 600,000 rapid tests, 300,000 from the federal government and 300,000 from the private sector. As of today, we have confirmation of shipping for 268,000 tests, and that's 162,000 from private and 106,000 from the federal government. We do not have shipping dates yet for the remaining 332,000 tests that will be delivered to PI before the end of January. And after the federal announcement yesterday, we anticipate that number will increase even further. We currently have 19,000 home-based rapid antigen screening tests in our inventory. We currently have approximately 130,000 ID Now tests in our inventory as well. These tests are not take-home tests, rather they are the molecular tests that are used at points of entry at health PI testing clinics and various clinical sites throughout the province. The federal government offers a workplace rapid testing program for workplaces with over 200 employees. Employers can apply to the Government of Canada and receive rapid test kits directly from the federal stockpile. We are optimistic that we will be announcing a distribution channel soon for workplaces with less than 200 employees. In anticipation of this support to PI businesses, in December, the province, in collaboration with the federal government, supplied over 10,000 tests to PI businesses. Community organizations, including charities, nonprofit organizations, and Indigenous organizations in PEI can apply to the Canadian Red Cross Stop the Spread and Stay Safe program to access rapid antigen tests to screen staff and clients. More information is available on the Red Cross website, and this program is sponsored by Health Canada. I would be remiss if I did not acknowledge and thank the Government of Canada for their leadership in securing rapid tests, vaccine, and other pandemic supplies. Their role in purchasing and distribution of essential goods during the pandemic is vitally important to small jurisdictions, including PEI. Lastly, anyone who is pregnant and is diagnosed with COVID-19 should contact the Labor and Delivery Unit at the Queen Elizabeth Hospital to connect with a healthcare provider who will provide support and direction regarding your prenatal care while in isolation. Anyone who is pregnant and a close contact of a positive case and test negative is required to follow the isolation and testing requirements. It is important to reschedule prenatal visits and ultrasounds that are planned during your isolation period. If you require urgent prenatal care during your isolation period, please call Labor and Delivery at 902-894-2243. Thank you to the thousands of Islanders who are isolating because they are cases or contacts. Thank you to the many family members and friends who are supporting their loved ones and friends who are isolating. Thank you to the staff, as always, at Health PI and in our office, and healthcare workers in the private sector, including pharmacies, who are working to respond to the spike in cases. We are being challenged to respond on many fronts: vaccine administration, testing, case and contact management, isolation supports, and responding to many inquiries, and we are meeting those challenges. Thank you to many other individuals and organizations who are supporting the provincial response. We have many tremendous partners that are an important part of the larger team. And with all those thanks to so many, and I know the Premier started off his remarks with thanking many as well. And I mentioned it earlier, we should take time to be grateful and thankful for all these individuals who are working hard to manage this wave of COVID-19 and keeping Islanders safe. So as we end every time, as we continue this journey, I said to someone yesterday, I think we're going to walk our way out of this, every day, one step at a time. And they said, well, we feel like we're trudging out of it. And so it may not be quite the walk that we wanted. So let us continue to be patient and kind. Thank you.
Thank you, Dr. Morrison. Trudging is a good word, I think, to describe it. Just before we go to some questions from our friends in the media, I know we've been getting lots of great comments about how much time you all love to spend with us and how much time you get. Dr. Morrison does have a hard stop here, so if we could go back to doing our 3 questions per journalist today at least, maybe that would be helpful. I have a hard stop as well, but it's for caucus, so I would just be as happy to stay here. And I'm joking, of course. But if we could just begin with Alison, and maybe if we can to limit it to 3 questions each today, that would be helpful. So to our friends in the media, Alison from The Guardian.
Understood. Thank you for your time. With not related specifically to masks, but what is it about the Omicron variant or the pandemic as a whole that makes epidemiologists believe it is time for the virus to become endemic? Is this the last wave, I guess?
And I think that's part of that hope as well. But I think some of it is based on on history and what we've learned in other pandemics in the last 100 years. It's based on modeling. It's based on some of the input from infectious disease experts across the world, and what they know about viruses. So I think this certainly may not be the last wave, but it will certainly, I think we're all hopeful that this will be the last wave which puts us in such a strain and potential strain on our hospital system and our society in the same way. And when we talk about it being endemic, and I think I referenced it last time, is where we're really there's still some transmission in the community, but it doesn't have the same devastating kind of impacts on us. And that's where you get into moving it to like influenza, where there's a seasonal bump in influenza cases, and it has an impact, but we protect ourselves. We have vaccines, and I think that's where we'll be with COVID, hopefully sooner than later.
And with all the new cases and with the ongoing information that there's this long COVID, this long hauler, is this something that PEI is tracking?
Mm-hmm. So, it's a good question. So at one point we were involved in actually a study that we were going back to do some antibody testing of those who had tested positive for COVID, and we had a chance to actually talk to many of the cases at the time about what symptoms they still had or how long their symptoms lasted. So we in terms of our present big increase in cases, we haven't been obviously doing a lot talking to them about long COVID, but following some of the information and the studies coming in about long COVID across the country and even internationally. So it is something that we are going to all have to look at. And what we're seeing now, of course, we've talked about it before, most people having mild to moderate symptoms. And it'll take a little bit of time for us to know the true impact of long COVID related to this particular variant, which will have the biggest impact here, of course, in PEI with these cases.
And I do have a quick question about masks, but I had a follow-up to that. Do we know how many people were experiencing long COVID after that first survey?
It was very small numbers, so I don't have those numbers here. But
Thank you.
Small.
And so what is it about an N95 respirator? Like, they're all over the drugstores, they're readily available. What is it about them that makes them not the best option if, you go online and follow the instructions? Should we all just be wearing the little paper masks or two of them?
Well, I think that the important part is that we were wearing masks when we're within 6 feet of people that you don't know, and we think about it as and wanting to make sure you wear masks that are well fitted. And so it has to do with also the people you're maybe looking after or the people that you're in contact with. So some of it has to do with the setting that you're working in, or if there are people who are going to be sick that you're looking after. And so the N95 mask can be fitted really well for healthcare workers, and then they usually often will wear a eye protection with it, and because they're looking after people who may be coughing on them and up close and looking after them, so they need the best protection possible. But if you're walking quickly through Sobeys or down the hall, you may not need that same level of protection, but certainly trying to make sure you wear it appropriately and it's fitted really well. And remembering it's one more thing, because first of all, when I come into the building, there should be people people shouldn't be here if they're sick. So, and I'm not sitting close to someone with my mask off and eating lunch with them. Those would be things that I can do to, as other layers, in addition to my mask.
Thank you very much.
You're welcome.
Allison.
Jessica Doria Brown, CBC. Hi, everyone. Dr. Morrison, my first question is about the isolation changes. My main question on that is just whether we currently have all the information we need about Omicron to make those changes to our isolation requirements today.
Yes, hi, Jessica. So we've been discussing this and reviewing the science and the evidence that's coming in across the country in terms of how long someone may shed the virus, and also looking at incubation periods. And so I think there's a range across the country in terms of exactly. They're all looking at the same science, but sometimes each province may have a slightly different risk tolerance and looking at practicalities as well. And I think Nova Scotia also reduced their isolation period, for instance, yesterday for cases to 7 days. And I think that's when I look at the evidence, and we're going really from 10 days to 7 days for those who are fully vaccinated. with some extra precautions for those next few days. I think it's very reasonable at this point, based on the science that we are seeing with Omicron. For instance, the median incubation period is 3 days for close contacts, and that's why, although there is a range, that's why the 4 days for us in terms of close contacts, but making sure that there's a test associated with that. Right now, the close contacts who are fully vaccinated isolate for 7 days and have a test before they get out. So really, the testing component part of it hasn't changed, but the reduction in that period of time.
Okay, thank you. My next question is about the additional nurses that Premier King mentioned right off the top. What specifically will they be assigned to, and where is the greatest need right now?
I'll let Dr. Morrison maybe talk about this as well, but the 15 nurses from the Department of Veterans Affairs will be deployed to help run and operate our mass vaccination clinics, which is of critical importance to us right now. And the 10 that have come back who are retired are going to work with public health nursing with contact tracing and to be in contact with those who are positive to make sure that they can have as much information as they can to help with their journey through a positive test. Is that
Yes.
Dr. Morgan?
And I think we were able to sort of have 10, and we actually got about 4 other ones. So we have, and they're helping us. They're being trained to help make calls to people who are positive for COVID-19, review with them if they're what they need to do during, as the Premier mentioned, during their isolation, what they need to advise. They give information to them about what they need to advise for their close contacts and who to consider a close contact. And they'll also identify if there's some that need further follow-up, who may be healthcare workers, for instance, or someone who's working in long-term care. And then we work with the team at the Chief Public Health Office in focusing on some of those vulnerable settings. So we certainly appreciate them, and a lot of them have worked in public health before, so we appreciate them coming back to help out.
Okay, lovely, thank you. And for my last question, just about the additional individual who's hospitalized, is that somebody new, or has somebody kind of shifted over?
There was one new admission yesterday to hospital for COVID-related reasons.
And sorry, are there any additional details you can provide on that?
No, the number in the ICU has not changed, and that's the total number in hospital being treated for COVID.
Okay, thank you.
Thank you.
Louise Martin, CBC.
Hi, and good afternoon. Thanks for taking our questions. Dr. Morrison, there's been a lot of questions about the guidelines for masking for children 2 and up, particularly at child care centers. Can you go over sort of the rationale behind that, whether the centers themselves have to make it mandatory? I think you listed it as a recommendation, but the guidelines are in that. A lot of parents seem to be a little concerned about putting a mask on their young child.
Absolutely. Hi, Louise. So, I mean, this is not mandatory. Absolutely. I mean, I've had 4 young children. At one point, I had 4 that were 6 and under, so having them all wear masks would have been, impossible in many cases. So I think it's to do what's reasonable. There will be some 4-year-olds and some 3-year-olds who will wear a mask as one additional layer. We've talked about it being not the only measure that in terms of early learning, but there'll be children who may be in school where there are exemptions already for them not to wear a mask if they can't be able to take it on and off themselves. They need to be able to do that, and so it's certainly not mandatory. It is a recommendation that if you're in certain settings where you're not in your household and you can wear a mask in that young age group, we have said all along that it is an option for children age 2 and up, and so it certainly would, continue along that. That would be a recommendation in that kind of setting, but it is not mandatory, and that was never the intention. And it's like all the things that we're doing are trying to together keep young people as safe as possible in these environments.
Okay, thanks for that. I appreciate that. And with the sheer volume of cases now, I'm curious, and maybe the Premier wants to weigh in on this from a public safety issue as well, but how is enforcement if, just with the volume of cases we're having, monitoring and enforcing people with their mandated isolation periods?
I would say I think we knew and had planned for the realization that we wouldn't be able to have as strict or as solid of enforcement of many of the public health measures once the arrival of Omicron came to the shores here. But we have been adamant about saying that, Islanders, for the most part, have been the people who have policed this with themselves and with their friends and within the community. We've had tremendous adherence to the public health protocols that we've put in place. I feel confident saying that nowhere else in the country has followed the public health protocols to the extent that we have. But certainly enforcement of some of these have been more challenging now with the higher case counts, et cetera. But I think we continue to see tremendous public health adherence, although there is frustration and there is fatigue with all of this. I think that goes without saying, but I think we have done a great job as a province from tip to tip to adhere to the public protocols, and I think that continues. But our enforcement has certainly had to change and adapt to meet the realization of what we're dealing with.
Okay.
Yeah,
Dr. Morrison wanted to weigh in on that, but
I would agree. I think. I know we all share that, we really, no one wants to get sick themselves, and we certainly don't want to transmit the virus to people that we care about or anyone else in the community. And Islanders have really wanted to look after our community throughout this whole pandemic, and this next few weeks we need to continue to do that collectively. And I think even having, based on the science around Omicron, reducing that period of isolation will be helpful for people, both for getting back to work, but also just from the challenges associated with isolation. So that will also help from a compliance point of view as well, Louise. If we find out about situations, however, we continue when we find out someone who is not isolating and they should be, they are referred to enforcement.
okay, thank you. And just my last question is about modeling. Will you be updating any modeling? We're hearing other provinces doing that lately, and sort of almost like a what the worst of the peak could look like on PEI?
So, good question, Louise. So really, over the last year and a half, we have not had the numbers which allow us to, thankfully, not allow us to do the modeling in the same way. So we've really been quite dependent on the national modeling. So we have talked about that, and we'll see what we can do and what impact that will have. I know that our team is is stretched at the moment in managing what we are doing, but we're following pretty closely, and we are able to look a little bit at what's happening in other places. But and we've said right along, if we can do all these things that we're doing and try to minimize how high our wave goes here in PEI and how fast it goes up, it will mean it's better off for all of us as we get out the other side of this wave.
Thank you. Have a great afternoon.
Thanks, Louise.
Thank you.
Sue Neepy, The Guardian.
Hi there. Happy Thursday to everyone. I guess first question would be for Dr. Morrison. Just following from Louise's question about modeling, I think yesterday Dr. Garden from Health PEI had mentioned that there's still a few more weeks to go before we reach our hospitalization peak. I guess that sort of seems to suggest that he knows what that is. But is there anything you can tell us about how many hospitalizations are modeled to be, I guess, for this wave?
So, Stu, I think, and Dr. Gardam is watching the same information really that is happening elsewhere. So we're watching what has happened with Omicron waves and their related hospitalizations in other countries and now in other provinces. And so it gives us a sense of and so you look at that in comparison to also what the capacity is in all the healthcare systems. So one of the reasons we've been always needing to be more cautious in some ways here than in other places is that we know we have only a certain level of capacity within our health system. So we've been watching that. So I do think we are the hospitalizations lag in terms of their high numbers a few weeks behind our highest number of cases, and I think that's why it's so critical we're doing everything we can in these next couple of weeks, because that will dictate how many hospitalizations we'll get in 3 or 4 weeks if we can keep the rate of our cases at a more manageable level.
Okay. I guess my next question was just sort of, I'd asked about the sort of shipments of rapid antigen tests received from the federal government, like by month between September, October, November, December. Mm-hmm. I still haven't gotten that, so I'm wondering if you can provide me with those numbers. I guess I've sort of asked through email, but I haven't been able to get a response.
Hi, Stu, again. So I think I know I gave you some of those numbers that you were looking for during the actual briefing. So we've received 290,000 tests that we've received to date. 120,000 tests directly to families and students, 75,000 to long-term care and community care facilities, 50,000 at points of entry, and 10,000 to the NGOs funded through social development and housing. And the remaining balance of tests that have been deployed throughout the province include, as a way of supporting the goal of monitoring and protecting the most vulnerable, include First Nations healthcare centers, Women's Network of PI, PI Autism Society, PI Council of People with Disabilities, family resource centers, shelters and outreach centers, first responders such as fire and EMS, small businesses, and frontline public service providers. And as I mentioned, then that leaves our inventory today as about 18,000 or 19,000 tests. In terms of monthly shipments, in September we received, and these are the rapid antigen at-home home kits, because we sort of talked about how many we had from a molecular ID now point of view. So in September we had 26,000, and then in October, this is where the shipments sort of come in little bulk numbers. We started ordering in more. We got 190,000 in October and November because that's how they sort of come in bulk numbers. So 190,000 between October and November. And in December, I mentioned to you the other day, I thought we had gone up to 80,000, and it was close to that, 76,600. So we order earlier for those other months. So as Omicron was coming, obviously we are ordering 300,000 for January, and now we're hoping that will double from the federal shipment based on the announcement yesterday.
Okay, thanks for that. So the October-November numbers, the 190,000, that is just the antigen, or does that include the ID now molecular?
That's just the rapid antigen take-home kits, Stu.
Gotcha. Okay, thanks for that.
Thanks, Stu.
Felix Arsenault, Radio Canada.
Yes, thank you. Oui, je poserais quelques questions en français, si c'est possible. On a vu d'autres provinces annoncer un peu les mêmes choses, de réduire l'isolement à 7 jours. On a vu dans d'autres provinces opter pour le 5 jours. Pourquoi est-ce que le 7 jours à l'île du Prince-Édouard, c'est la bonne option?
Bonjour. Comme vous mentionnez, vient de mentionner, il y a un peu de différence entre les provinces. Pour nous, on a regardé la science et puis on regarde notre tolérance pour le risque pour les cas de COVID ici. Alors, on a pris vraiment la même date que Nouvelle-Écosse et peut-être d'autres provinces. Et puis, ça réduit de 10 jours à 7 jours si vous êtes vacciné. Et je sais, pour maintenant, on commence avec ça parce que on regarde le nombre de personnes qui peuvent quand même infecter les autres. C'est plutôt dans les premiers 7 jours, mais quand même, on ne veut pas que les personnes sortent et entrent dans les foyers de longue durée dans les jours qui suivent non plus. Alors, il faut porter les masques, les choses comme ça. Alors, pour nous, je pense que c'était avec l'équipe, on regarde l'évidence et pour nous, c'est une bonne décision.
Et est-ce que, on le sait, est-ce qu'on ne met pas plus de gens qui sont à risque, qui pourraient être exposés avec, quand on descend là, à 7 jours comme ça, mais est-ce qu'on est un peu rendu à ce point-là de la pandémie où il faut faire ces actions-là et réduire le nombre d'isolements?
Non, je pense que c'est plutôt qu'on regarde l'évidence qu'on a et puis pendant toute la pandémie, on balance ça avec, on veut minimiser l'impact sur les gens parce que c'est pas facile d'être isolé. Et ici à l'île du Prince-Édouard, c'est aussi quelque chose qu'on veut garder les close contacts en isolement encore pour plusieurs jours parce qu'on pense que c'est important de réduire la chance d'infecter les autres.
Et juste une dernière question du côté des travailleurs de la santé. Est-ce que vous avez un chiffre de combien d'entre eux sont en isolement et ça ressemble à quoi l'impact sur le système de santé de ne pas avoir ces travailleurs-là?
C'est une bonne question. Je pense que c'est à peu près 20 et 40 qui font un test stay, mais on peut envoyer les numéros exacts. Je n'ai pas avant moi, ça vient de HealthPI, mais on peut vous envoyer ces nombres plus tard.
OK. Parfait. Merci beaucoup.
OK, merci.
Merci, Felix. I think that brings an end to the questions from our friends in the media. So thank you for accommodating us today with following the healthcare briefing protocols with 3 questions. But thank you, Dr. Morrison, as always. And to all Islanders, stay safe, and we certainly appreciate your continued patience. So have a good day.